recognition. So this idea, or actually, when you say, I was going to quote Gary Slutkin, who launched the first program, and it's not completely fair to give him credit for everything because it's actually a very old idea. You can find traces of it in the world religions going back thousands of years, which is the community can become troubled and the individuals reflect and exhibit the community's troubles. But Gary Slutkin, who was working for the World Health Organization, and I can't remember exactly which issue tipped him off, but he was working on communicable diseases and realized that you could focus on each person who had this disease, but you also have to focus on the things that create the conditions that continue to perpetuate. So the individuals who exhibit the problem are not wholly responsible for that problem. They're just reflecting the overall social issue. But then he thought, as a physician and someone who was trained to intervene in public health, I guess I think he said this to me, that the perfect example is the guinea worm, that they realized you could yell at people and tell them not to drink water out of ponds and puddles and try to scold people and change their behavior, or you could create a mechanism that would prevent them from catching the disease and spreading it. And they invented the little straw thing that I forget the whole story. So he comes back to the United States and is in the midst of seeing news reports about shootings, and it occurs to him, he says, that the willingness to carry a weapon and use a weapon to resolve personal disputes and all kinds of other things is a behavior that's reflective of a culture. And especially in the US, as I'm sure you know, we have a very gun-oriented culture. Our politicians believe that the more people that have guns, the better off we are. And so they've just populated the country with sophisticated weapons. And why are we shocked when people misuse them? So we try to punish our way out of problems. So all those insights led him to think, couldn't we take the lessons of public health while we're focusing on the individuals who are affected by gun violence and most likely to participate in gun violence? Couldn't we also focus on the cultural and social conditions that continue to populate the problem? Turning that, though, into a fundable, government-sponsored, situation-specific intervention program is quite challenging. Of course, your enthusiastic or eager political official thinks, oh, I love these ideas, but we need to be able to show that they're effective. So they come to people like me and say, let's do an evaluation. And the challenge there, as I'm sure you know, is the unit of analysis you're focused on. So in a pure cure violence model, you're not identifying the culprits. You're not going after the most at-risk population. You're trying to build community structures and social awareness of violence and build a community which looks out for itself. So that's why they hire, you've probably seen the term outreach worker, violence interrupter. They try to hire people, ideally 35 years old, who have some experience with the street. Maybe they've done time in prison. They can be there and talk to the 15-year-olds because they know the neighborhood. They share a history. And that's a way of transmitting a peaceful response or a nonviolent response to conflict and stress to those 15-year-olds, instead of allowing them to figure out for themselves how to deal with their conflicts and stress, because this culture encourages violence. So you build a program like that and have people working in that neighborhood, but you don't sign them up as clients. You don't identify them and say, this is the high-risk person. Let's write their name down, keep a list of the people we're working with, and then tell the police when something goes wrong. You don't treat them as patients or clients. You just treat them as members of the community, which means to evaluate that program, you're basically doing global changes at the community level and then trying to measure change at the community level. So you end up with an evaluation design, which is, let's test these 3 neighborhoods versus those 3 neighborhoods. And you're just never going to get great statistical power if you're being judged on the same metrics they use for individual programs and individual behavior change. That's a very complicated thing to persuade either the elected official or the philanthropy with all the money that we judge our impact and effectiveness by tracking changes in the overall level of violence in the neighborhood, not can we change the behavior of these 12 people. So it's a more difficult evaluation challenge, and the literature is often behind. And of course, again, the police love it when lawmakers turn to them and say, what works? Because they can go to their research partners and come back with statistically respectable effect sizes and explain variance and everything else and prove to that elected official this works. Because they're dealing with individuals. They're changing the behavior or controlling the behavior of individuals. And there are lots of researchers who are perfectly willing to play that role. And when you go to the literature and try to find research articles about violence prevention, you end up seeing a lot of that and not very much in a public health framework of trying to move the needle at a community level. So our attempt to do that was to do face-to-face interviews and surveys with people in the communities. And I don't know if you saw it, but we used a technique called respondent-driven sampling, which is instead of calling people and trying to do a probability sample of an entire neighborhood, we went to a neighborhood, recruited the first respondent who met the conditions. We focused on males. We didn't want to have to try to control for gender, and males are 90% of the problem. So we focused on males over 18 years old, but under 30. As soon as we found someone, we would say, do you live in this neighborhood? If they said yes, we asked them to prove it by covering the name on their driver's license and showing us their ID so we could see the street address. So we confirmed that they lived in the catchment, in the boundaries we were talking about. And then we did a full interview with them. We would have a tablet, an iPad or something, and we would ask provocative questions like, have you ever this? Have you ever that? What would you do in this circumstance? And if it was at all provocative, we would turn the tablet toward them and say, go ahead, you can touch the screen and give us your answer and we won't see it. So we asked things like, have you ever been shot at? If violence breaks out in your neighborhood, who would you trust to show up and help? And then give them a list: police, medical services. So we asked a bunch of questions about the community. And then we said, do you have friends that live in this neighborhood? If you know other people here who are under 30, over 18, and male, tell them to come on over, because we give $20 to every person who finishes this survey. And in fact, if you refer 3 friends to us and they each do it, we'll give you an additional $10 for each one they do. So we spent some money incentivizing responses, which works. And so we would get these really nice, quick, rigorous samples. So it's not a probability sample, but the literature says when you build out, so one respondent gave us 3 referrals. Each of those could give us 3 referrals, 3 more, 3 more. Once that network gets out to 7 iterations, the literature says it's a representative sample. It's respectable statistically. So we did those all over the city in places that had these programs and places that didn't. And that was some of our best results, I think, because we're not just tracking reported crimes or shootings or when someone's arrested or when the police tell us there was an incident. We actually asked the young men in that neighborhood about it. I haven't seen many more examples of people doing that because it takes a lot of work. Most people just want to get the official administrative data and tabulate shootings and, do their articles and send them off. Yeah, that's a very important question. That's one question of maybe 10 that reflect a concern for implementation quality. And I have written before and said in talks that that's where we need to go with this whole field, is start to generate evidence about not only who's the most qualified interrupter or outreach worker, but how do we know they're doing a good job? We don't know if this works. We got to collect the data. Don't tell me you know what a good outreach worker is and how to train a violence interrupter. Let's collect the data and see if the people you trained actually have better responses in the neighborhood. I want to interview the young people they're talking to and ask them what they think of this violence interrupter. Because I always say the most wonderful thing about teenagers is they don't care about us. They don't care what we think. So how do you get a teenager to absorb and embrace the social values we want them to have to preserve safe society? You don't accomplish it by yelling at them and threatening them. So how do we train workers to be able to do that? We don't know yet. I
Yeah,
started out
making
in
a
life
note.
as a social worker. So I was before I turned to research, I was, being trained to work with people. And my first job was with young people in a juvenile court on the West Coast. And I remember the key thing was the ability to listen, that most adults think, I'm in charge here. You need to listen to me. Let me tell you how it is. Outreach workers and violence interrupters have the same disorder. So if I heard that 35-year-old sound like they were lecturing the 16-year-old on the street, I would, if I were the program manager, I'd want to pull them aside and say, let's talk about this. Do you really think lecturing this 16-year-old is the way to affect their behavior? Do you even understand why they're doing what they're doing and how they view the world? So I think the dynamics are the same. And of course, adolescent development and the time it takes for a 10-year-old to become a responsible 40-year-old is the same worldwide. But the context is different. The economic challenges are different. The density of populations, the extent to which you encounter people on a regular basis. Living in Brooklyn is different than living in the mountains of Colorado. So of course, social dynamics changes, and the neighborhood structures affect the probability of people encountering one another. All that stuff is going to vary from place to place. But the basic human dynamics, I would think, would be consistent. So the program model would have to be adapted for each context, but the philosophy behind it should certainly remain the same. Yeah, that's a classic theory in criminology. It's called strain theory or social strain. My family can't afford this. I have a 25-year-old son who's still living with us because he can't afford his own place. And that breeds anger. And then you see people who are apparently living really well, and it just pisses you off. And so that is, of course, universal. And when you talk about someone who observes the fact that during an economic expansion, we still have a crime problem, you could see that here too. The stock market's doing great. Why are people still hurting each other in this poor neighborhood? And the simple minded way of thinking about that is, oh, those poor people are more violent than the rest of us. And I'm always saying to people, there are different kinds of weapons that people use. Some people use lawyers as their weapon, and they steal other people's belongings and hurt people and, try to get their own way using lawyers. And, you know, that's called, the Wall Street gang. And if you don't have access to that, you use physical force. But it's the same impulse, the same behavior, the same human inclination to disregard the interests and feelings of other people while you're selfishly trying to build up your own. Well, you got to have enforcement. You're always going to have police there. You need that presence on the street. The neighborhood needs to know that there's someone there. Then you need to pay attention to the basic life supports people need, which is a very difficult thing to do in this country, at least. Prevention against the failure of housing and food supply, because if you have those basic social disadvantages, you're going to continue to have problems. So what we do is provide all the law enforcement, and then we're more than willing to provide the focus on individual pathology. So we'll do drug treatment, behavioral therapy, family therapy, all that stuff. That's people pay for that, which is important, but it's not a solution. And then you need the stuff we've just been talking about, which is all this outside the bureaucracy of government at the neighborhood level, organizing the people. Again, my early career, I was in the foster care system as a social worker, and all the people around me thought the way you do that was to fix the behavior of the parents. And I thought, we can't afford this. Why can't we recruit? I said, every house with a child who's in danger should have a volunteer grandmother who's there all the time. Like the 60-year-old experienced grandmother should be there with the 20-year-old new mother, helping them learn things, and not to think everything is a problem that needs professional, someone with a degree in psychology to fix their innate problems. Same thing with violence. You don't wait till it happens and then figure out why it happened and try to fix this person. You build the barriers that naturally mitigate the inclination to be violent, and just focus on that. It's more cost effective, cheaper in the long run, but that's not a replacement for all those other things. As you imply, it should be a partnership, but partners respect each other, and that's the main challenge right now. And how do you get law enforcement, medical professionals, all those other systems and bureaucracies to actually respect the work of that 35-year-old guy who got out of prison a few years ago that's now in the neighborhood talking to teenagers. That's still a challenge.